Today we will discuss about postpartum hemorrhage. So postpartum hemorrhage is the most important cause of maternal morbidity and mortality worldwide. Almost half of all maternal deaths in the developing countries are mainly due to postpartum hemorrhage. So what is PPH? What are the different types? What are the risk factors of postpartum hemorrhage? How can you prevent? We have already discussed this under active management, the third stage. How to identify and the different modalities of management. So when there is a blood loss of more than 500 ml in vaginal delivery or more than 1000 ml in cesarean section or any blood loss resulting in hemodynamic instability is a definition of PPH. So the causes we can classify into due to tone, that is atonic PPH. There is tissue, the four T's. This is to remember the causes. Tissue means any retained products inside the uterus. Then traumatic PPH due to trauma and due to thrombin, that is DIC. And another classification is primary and secondary. When the bleeding occurs immediately after delivery, within 24 hours, it is called a primary postpartum hemorrhage. When it occurs after 24 hours, it is called a secondary PPH. So these are the risk factors. That is multiple pregnancy, multiparity, a previous history of PPH, whenever there is a uterine overdistension, polyhydramnios. Then intrapartum factors are prolonged labor, instable delivery, precipitate labor when the patient is under GA. And how can you prevent? Improve the general health of all antenatal women and treat anemia. And a high risk should be identified during antenatal care and referred to a tertiary hospital with blood bank facilities. For all mothers, blood grouping must be done. And these are the antenatal period factors we can do. During the intranatal period, slow delivery of the baby, avoid general anesthesia as far as possible, active management of the third stage of labor. This is the most important step which helps in preventing PPH. Then examination of the placenta after delivery to look for that it is complete. And oxytocin must be continued for 1 hour postpartum. A routine exploration of the birth canal to look for any injuries. And all patients delivered must be observed closely for the first 2 hours after delivery. And whenever you are suspecting some coagulation abnormality, the coagulation profile has to be done. Vital signs will be near normal till 30% of the blood volume is lost. And